But first, in just a few weeks, uninsured Americans are going to have the chance to sign up for coverage through the new healthcare markets. But opponents of the law are already stepping up efforts to sabotage Obamacare.
Let me tell you what we're doing. Everything in our power to be an obstructionist.
That's Ralph Hudgens. He's a Republican, and he's also Georgia's insurance commissioner. He's bragging publicly about his state's efforts to undermine Obamacare. And he's not alone.
States are very wise to choose not to cooperate in any way because...
That's Twila Brase, president of the Citizens Council for Health Freedom. She's voicing her strong opposition to Obamacare and healthcare exchanges with radio ads like these.
We have a legal right to refuse to enroll in government exchange coverage.
They have billboards, bus shelter posters, and flyers that are passed out on college campuses. All of it's part of a campaign to convince Americans, especially young adults, not to sign up for healthcare exchanges when they become available October 1st.
If you do not sign up for them, you do not bring money into them. It does not fund the cost of operating them, and therefore they are more likely to fail.
Another group, FreedomWorks, is telling people to burn mock Obamacare draft cards. They say younger Americans will pay for coverage they don't need.
They're typically healthier, and they typically don't go to the doctor as much, but they're going to be paying for the system that will cover health care for all Americans.
In states with some of the highest uninsured rates in the country, like Texas, Florida, Georgia, public officials have declined to set up state-run exchanges, opting instead to let the federal government run the exchange. Undeterred, the nonprofit group Enroll America is going door-to-door with their Get Covered America campaign, urging those same young people to sign up.
That's a conversation that's not about politics. It's a conversation about the new opportunities for health insurance that meets their needs and meets their budget. And we're seeing incredible interest in the conversations we're having across the country.
And so we're going to have a conversation about this right now. So joining me from Washington is my good friend, Chief National Correspondent John King. Thanks for joining us, John. Look, I want to make clear, and you've been following this argument for a long time, we're not vilifying people who are against Obamacare. You've been looking at these arguments yourself. When you hear their arguments, do they have a point?
Well, they say they have a point, Sanjay, in the sense that, look, there's a lot of politics involved in this, and some of the criticism is just because the president's a Democrat and a lot of the critics are Republicans. But some of it is on principle. There are a lot of Republicans, a lot of these organizations involved who think this is too much of an overreach by the federal government. They think Washington shouldn't be involved in these kind of decisions. They think state by state or community by community. However, they have a point, and some of them are standing on what they believe to be a proud principle. The issue is, at what point do you have to acknowledge in politics that you have lost?
And John, that if you just look at the history of some of this, like the individual mandate, for example, and I worked at the Clinton White House in the late 90s, but before that even, the individual mandate was something that came about from primarily right-winged organizations. They were the ones who wanted it, and now these are some of the same people who are rallying against it. Isn't that right?
You're exactly right, and that's a reflection of, look, politics changed with the times, and it was the Heritage Foundation and other conservative groups back in the day when they thought there were going to be major changes in health care. We see this sometimes when the NRA thinks there are going to be major changes in gun control. It was for background checks at one point. Now it isn't. Conservatives were once for an individual mandate, believing that if you did it on an individual basis, at least you empower the individual. The individual is making the decisions as part of the bigger process. But when the politics changed and they thought they could beat a quote-unquote national health care plan or a Washington dictated health care plan, they said, oh, never mind, we're not for that anymore.
Right.
Welcome to politics.
Yeah, you know this better than anybody. Let's talk about the practical part of this, as you mentioned. We talked with some members of Congress who said they're not going to help their constituents sign up. They're going to be obstructionists, as you just heard. Is that taking it too far?
It's dangerous. Look, each member of Congress has to make their own decision, and each member of Congress is then judged by the 500,000 or so people who live in their congressional district. Now, if you're a safe Republican, a Jason Chaffetz in Utah, a lot of these Republicans don't face much opposition, or if they did face opposition, what they would worry about is a primary challenge from the right. They can talk like that, but here's the challenge. You represent your entire district. There will be people calling who may be even against the health care law, but it's the reality, it's the law of the land, and they have a question. Where do I go? What agency do I call? Where do I get the paperwork for this? I'm having a problem with this agency. I don't understand this. Well, that's a congressman's job. That's a congressman's job. So to say, no, we're not going to answer that question because we don't like that law, that's risky.
You know, we just heard in that piece a lot of people who are against Obamacare. John, I'm sure the political pundits they're always listening to you and to what you have to say. If you were guiding them, either the HHS or the White House, I mean, what would you tell them in order to turn the message around?
Well, I tend to try not to give advice to the politicians, but I will tell you this. From your travels and from our poll numbers, people are confused about this, and I'm sure you get questions about this. How is it going to affect me? When is it going to affect me? There are a lot of people who think, you have to do quote-unquote comprehensive or else you can't pass a bill. If you could do this one piece at a time, it would probably be easier for people to understand. You have seen the president in past political fights focus on the things that are popular. Young people get to stay on their parents' health care a little bit longer. Right. You can't deny somebody coverage for pre-existing conditions. The president has to find, as he goes forward, an implementation communication strategy, a North Star that says, when we get here, I think this will be better for you, but there may be some bumps along the road, and the government's going to have to do a good job in helping people deal with those bumps. Again, not my job to give advice. I'm not endorsing the health care law, but as you make these big changes and people have questions, and what they're hearing is this very polarized political environment, that there needs to be a place for them to go where they can get advice they trust, and that's a huge challenge for the president and the entire administration.
John King, thanks so much for joining us. Appreciate it.
Thank you.